Weekly Friday with Sarah and Christina.
Sarah's back this week.
Yes.
She missed last week, but it's okay.
I missed last week. I heard you guys talked about post-op care. I'm really sad I missed it because I'm the post-op nurse.
I know, but I had Shley. They did good.
Shley kills it. She always kills it.
Yeah.
Do you want to talk about what this topic is this week?
Yeah, so this topic this week, we are going to be discussing recovery houses.
Dun, dun, dun. I have a lot to say about recovery houses.
Yes.
Good things, bad things, mostly bad. To
The
be
good,
truthful.
the bad, and the ugly.
Mostly ugly and bad.
Yeah.
If we want to kind of get right into it, I chose this topic, recovery houses, because it sounds so appealing. It has food, stay, they help with your medication, they pick you up from surgery, they pick you up from the airport. It's all sounds too good to be true, and most of the time it is. One, they're not legal in the state of Florida,
Right.
so people will open recovery houses not as an LLC, they'll just advertise for them. And I've had patient stories where they're not picked up from the airport, they're stranded at the airport. They pick them up from surgery 3 hours or plus after they were supposed to be picked up. I have like countless stories.
Yeah, like do they give pain meds?
Yes, they will take their pain medicine. Most of the time it's a narcotic. Here at Pure we prescribe 5 milligrams of oxycodone is Percocet. And they take their pain medication, they give it to other people, or the medication that they're administering to the patient isn't actually their prescription, so you don't even know what you're getting.
Right.
You could be getting Flexeril, you could be getting 10 milligrams of someone else's Percocet. It's a mess.
Yeah.
It's very unsafe.
Right, and they don't know if you have allergies to medications, they don't take your medical history. But this is why we are always about patient safety, and you know, here at Pure, we're trying to make it so you guys don't have to think about that. So I know we've mentioned it before, but we're going to talk about it again today before we get into the good, the bad, and ugly. But we have the AC Hotel. We have packages for them. And not only that, we also have a company that we've merged with, which is the Med Miami.
Yeah.
So can you tell me about Med Miami?
So with Med Miami, it's we met the owners and they have actual medical staff. They have registered nurses with license numbers who have passed their boards exams, who are actually certified active unrestricted licenses for the state of Florida. They have medical assistants, they have CNAs that are certified without any restrictions on their licenses. So they are, first of all, like properly formally trained on how to take care of people. And that comes with also knowing how to like properly assess someone. People in recovery houses who are taking care of patients, their caregivers, aren't properly trained. They're not medically trained, so you don't know how to do a proper assessment. You don't understand if there's certain vital signs after a surgery, if that is within expected range, if that's expected with the patient's surgery or not. So Med Miami is, first of all, like verified, they're certified, they have like a clean record. They pick you up from surgery. There's different packages, so they can have, I believe, 8-hour packages, 12-hour packages. They can stay with the patient 24 hours after surgery. What I love most with these caregivers is that they are actively teaching your family that's with you. So they'll show the family members that come with you, this is what this means, this is the proper way to help maybe you shower or get up and out of bed properly. This is like vital signs that are within normal range, that's normal. So yeah, signs of infection. It's not only them doing it, but leaving the family prepared to do it on their own whenever their shift is over, which I think is super, super important.
Yeah, and I've also seen like in recovery homes, they sometimes will just leave you in the bed, like not shower you. So now you're in your saturated garments, and that's how infection starts.
Sure.
Ladies, like you have to get up, you have to walk, and you need a professional to help you through this journey because it's not easy.
No, absolutely. I've heard just countless horror stories where a patient would be like calling for help, and it's I don't know, hour, 2 hours before somebody comes to help them. just
In the
not
recovery
attentive
homes.
in recovery
Yeah.
homes. Yeah, in recovery homes.
And then there's like recovery homes that have like 8 girls at a time. Can you imagine 8 BBLs or 8 mommy makeovers? I'd rather die. Like, no way. That's so much.
It's a lot in one space. It's not a healing environment. It's not a quiet environment.
It's
You
not
don't have
calm.
one-on-one care. If
Yeah.
they say you have one-on-one care, it's probably not true in a recovery
Correct.
house. There's no possible way. There was a patient that told me she booked a private room, and they said when she got there, "Oh, I'm so sorry, we accidentally overbooked. You're sleeping in a recliner in the living room." So
Oh.
she was sleeping in a recliner in the living room, like no privacy, not what she paid for, not what she expected. It's just setting expectations is horrible. Places
Right,
like
and
this.
once you're locked into that contract in the recovery
you
home,
don't
they
get your
kind
money back.
of, yeah, and it's either you're on the side of the road finding an Uber or you're gonna stay there. So that's why we highly recommend our hotel package with
Yes.
the Med Miami.
Yes.
And I believe it also includes Make It Pop if you upgrade. So I mean, it's
It
like,
has so many extra layers, extra benefits for our patients that, again, it just always comes back to making sure that you guys are ready and you guys are taken care of. Because as a nurse, as people who care about our patients, I want the best for you guys, and I want to make sure that you're taken care of. And it truly breaks our hearts when we hear stories like this from patients that have to go through it, and they just kind of push through and get through the situations, and they're so ready to go home, back to New York, the Midwest, Cali, wherever you guys come to travel to see us from. They're just ready to go home, and that's not what we want. We want to make sure that you're gonna miss us when you leave, and you're gonna miss this experience, because we want it to be a good experience.
yeah.
Okay. Shelley wants to know the name of our hotel.
The AC Hotel. It's the AC Hotel in Dadeland.
Right, so it's connected to Dayland. So when you need to walk, you can walk and shop at the same time, which is a plus.
If you're feeling okay, you can have your family or Med Miami, the caregivers will walk around with you in the hotel. You don't have to leave to
Right.
go outside in the heat. You go directly to the mall,
Yeah,
so you
there's
can
like
walk around.
a little hallway that you can go into the mall. Which
They
is
have
really nice.
restaurants in the mall, so if you don't feel like eating maybe the food that you have in the hotel, you can order like a healthy meal, you can order a salad, something from the restaurant, so it's literally all in one spot. And it's only about 10 minutes from Pure, so coming to and from appointments, getting from surgery to the hotel, you don't have to ride an hour on the Palmetto, which is a major highway here in Miami. It's very quick, so you can just get back to the hotel and
Right.
start to kind of get comfortable.
And Jessica can also go do the massages at the hotel, so that's another plus. So Jessica
Yeah.
can always go and massage you at the AC hotel, and it's just to your guys' benefit. We want to make sure you're comfortable.
Ladies, how can we book the package with Med Miami and the hotel?
Perfect. So if you haven't booked your surgery yet, there is a package that includes the hotel, the Med Miami, Make It Pop, which is additional resources for you before and after surgery, like nutrition guide, they do blood work. All of that can be added to your surgery price. So it's all one package that you talk with your surgery coordinator about. And that's if you haven't booked already. If you have a surgery already booked, I encourage you to message us in Clara or give us a call, and we'll transfer you to your surgery coordinator, and we can look for a way to add it in to your surgery price in total.
Right.
If any discount on Med Miami packages if you're a pure plastic surgery patient?
I believe so.
I think
yeah.
so. I think that they have something for our patients specifically. So, like Sarah said, just reach out to your coordinator and she'll be able to give you all that information as far as discounts. If you want to upgrade your package, if you want to upgrade it to more than 24 hours, they'll have all those answers for you.
Yeah, I know that the AC hotel price, if you reach out to them directly, you don't mention you're a pure patient, they'll give you a price for the hotel, right? Just like you're booking any hotel. If you let them know you're a patient of Pure, there is a special discount for you. So you can book through the AC hotel. We can also add it in as a package through us. So there is a discount applied to the hotel stay.
So you will see an amount on the website, but I always say take into account that there's taxes included. So when you do call us and ask for the information for the hotel, the taxes are included already in that package. So always keep that in mind. Everybody always forgets taxes. So we
hotel
already
fees, taxes, fees, I see. So once you get the price from us, it's already set. There's no
Everything's already
added
included.
extra costs that
Right.
always, I think it means everyone, like
Everyone.
extra little things that you don't know
Mhm.
coming. No surprises. We want to
Yes.
make sure it's very clear and straightforward.
We have a patient that's coming in January, and she
Okay.
asked, I may have missed it already. Does the package come with caregiver and book for surgery in January? So trying to get everything done ASAP.
Yes, reach out to your coordinator as soon as possible.
Yeah.
I mean, January is gonna be here before we know
Yeah.
it. So
No, it's not too late at all. No,
It's
I
not.
mean, patients that are coming this next week, not too late.
Yeah.
January, of course, not too late. So
Yeah.
reach out to us.
We'll always make it happen. We always figure it out.
Of course. Yeah. We're so excited to meet you.
Yeah.
One question at YouTube. We're live on
Wow.
YouTube too. Yes.
Okay.
Ladies, hi. This is Sandra, and she asked, how many fajas do you need after a tummy tuck?
Oh.
Oh, well. So you need, I mean, there's a stage 1 faja, which is low compression. You can start with that faja after your drains are removed. Typically that's 2-3 weeks after surgery. It depends if you want to move into a stage 2 faja, which is high compression. It's very tight fabric, very constricting, helps like very much so mold the body, contain the swelling. So we're talking 2.
Right.
But eventually as swelling comes down, the sizing goes down, so you could purchase a third. You could get it altered with a seamstress, so you don't have to keep purchasing smaller sizes.
Right.
I mean, you had your tummy tuck, how many fajas did you buy?
A lot.
Unless you have like 3 or 4.
Yeah, I think I have
Yeah,
like 3 or 4. But my last one, I did start to take it in because I was like,
Yeah.
I love the way that it
Alterations.
felt. You just have to find the one that snugs you the right way.
Mm-hmm.
Don't be like me.
Okay, she said, thank you. Can't wait to meet you all.
The fajas. We'll do a live just on fajas.
Yeah.
Was needed. Okay, another question here. How can we get in contact with Med Miami?
So you can reach out to Mid Miami specifically on Instagram. If you want to book through us and book a package, it would be through us. So it kind of depends on how you want to go about booking them. But they do have an Instagram that maybe we can add, so it's easier for you all to find them.
Yeah, maybe we can tag them in the caption.
Yeah,
Willie?
perfect.
Yes,
What
I will.
time?
I
What
will.
time? William?
Or like Willie.
Okay, it's AB. The girls are doing fine.
Good, good to hear.
This is a wonderful, informative session. Thank you so much for
thank
sharing.
you. You're very welcome.
The filter-free Fridays.
Those are free Fridays. We want to give as much information to you guys and recovery houses, caregivers. I think that's just as important as where you book the surgery. So,
Yes.
I love this question. What's the difference between Make It Pop and Med Miami? It's the
Oh.
same thing?
No.
Ooh, okay. So I'll do Make It Pop. Make It Pop, and we can actually share maybe Dr. Earl's live that he did with Make It Pop owner. So Make It Pop is a multidisciplinary resource for patients having surgery, before surgery and after. So multidisciplinary meaning mental health therapy, so there's a psychiatrist involved, there's a nutritionist involved, there's a nurse involved. They help with nutrition planning, they take your blood work to see if there's certain blood levels that you maybe need to work on before surgery. They check your iron, maybe there's a certain diet that your body prefers to be on to make sure you're healthy and clean eating for surgery.
Don't they have like
Genetic testing, yeah. So there's certain genetic markers that they'll look for to see if maybe your family is predisposed to some certain illness. Make sure you're completely safe going into surgery. They talk you through like how to put the faja on,
Yes.
like what to expect with like this is how your body heals after breast surgery specifically, or after liposuction specifically. So
They also help you with sizings of your faja. So
little details about like if you've heard of Facebook groups, like Facebook groups I think are great for like resources that patients have gone through. So they'll share their experience. Patients will talk about, yeah, this is what worked for me, or this is what worked for me. Very similar, but
it's one-on-one coaching.
Yeah, it's one-on-one, and it's I think a little bit leveled up with professionals who are helping you through it.
And then Med Miami is, oh, okay. Med Miami, I'm still learning a little bit about Med Miami. So it's basically your caregiver where they're going to be checking your vitals, they're going to be making sure that you're up and walking around, they're going to make sure that when you're in the hotel, when you're home, you're taking your medications. If you're feeling weak or you're not feeling well, they're gonna be the ones to say, okay, we need to either drink water because we're dehydrated, which is the number one reason why a lot of patients go to the hospital is because you're dehydrated.
Yeah, it's really simple
Yeah.
things that you can do with your caregiver. So,
Right. Walks.
yeah, walking, medication administration. Med Miami is the physical caregiver that you
Right.
have after surgery.
Right.
Make It Pop is additional resources that it's all virtual work. So it's videos and it's emailing and it's additional resources that the patients have.
Ladies, where can we find Jessica's, the masseuse's information?
So Jessica's on our website and it's Bestie Genie, so we can add her Instagram to this as well. And if you're an upcoming patient of ours, message us in Clara, we can send you the links for her Instagram and how to book her.
She's so sweet, she's
Yeah.
amazing,
She's
she's
the best.
here.
She has magic hands.
No,
Literally.
literally, she massaged me, she massaged Christy, like
Yep.
she does you good. She's awesome.
All right.
Yay,
So
is that it?
yeah, that's it. I guess whatever you guys want to hear about next week, you can leave it in the
let us
comments or Clara us. I don't know.
Yeah.
Oh, before we go, if you hire Meg Miami, do you still need a family or friend with you?
So yes, because they are not gonna stay with you the
Yeah.
whole 7 days.
Yeah, so I mean, if you want to pay for them to be with you that extensively, of course you can, but it's really a good start off. It's a good few first days to teach your family or your friend how to do these things so that for the rest of the time you're here in Miami, they can take over and have confidence doing it on their own.
Right, and even after 5 days when you go home, it's always good to have a family member that has the knowledge to take care of you just in case something happens.
Yay! Let us know if you guys have any other questions, any recommendations for our next video. We'd love to hear it. Thank you so much.
See you guys next week.
Nice.
Bye bye!